Hello, humans. Michael Herrick here with HIPAA for Humans, realistic cybersecurity advice for healthcare. I get more and more questions from people in the medical marijuana industry, people with running cannabis dispensaries and so on. These cannabis dispensaries and related businesses are under state law, are considered a new kind of healthcare provider, dispensing a new kind of medicine. They're considered healthcare providers under state law. And so they come to me and ask, as new healthcare providers, what are their HIPAA obligations with regard to healthcare data, privacy, and security? Well, there's a simplistic answer to this question. Recognizing that HIPAA is a federal law, and federal law does not consider marijuana to be a medicine. Therefore, cannabis dispensaries are not considered healthcare providers under federal law, and the federal law of HIPAA simply does not apply. That's a very simplistic answer. The reality is, of course, a lot more complicated. I think the most important thing to recognize is the consumer side of this whole equation. Ultimately, what it comes down to is that consumers will not accept that the data that they share with their dispensary, with their prescribing physicians and so on, consumers will not accept that their personal data has no legal protections whatsoever. Consumers will not accept that they have no expectations of privacy or data security when they share information to obtain medical marijuana. Consumers won't accept that, and regulators are beginning to respond to that consumer pressure and looking for ways to bring those kinds of protections that people expect for their sensitive healthcare data, regardless of where they go and get their medicine. We're seeing a couple of interesting approaches. There's going to be a lot of experimenting. There's going to be a lot of innovative ways that states are going to try to tackle this, particularly during this transitionary period when federal law is still at odds with our state laws. One of the approaches that I am finding very interesting is coming out of the state of Illinois. They have a medical marijuana program with laws and regulations supporting that, and the regulations in Illinois, the regulations that are enforced at the state level, require cannabis dispensaries to adhere to and follow all of the standards of the HIPAA security rule. So although HIPAA, the federal law, may not apply to a cannabis dispensary in the state of Illinois, the state of Illinois requires that cannabis dispensary to follow the HIPAA standards. As I always say, HIPAA is not just a U.S. federal law, it is also an international standard for data security and privacy around healthcare. And so that's what the state of Illinois is doing. They're effectively importing the HIPAA security standards and requiring people to adhere to those standards and follow those standards. Very interesting approach. They're also providing very specific guidance, and I think very good guidance, about what that means for cannabis dispensaries. And they're being very clear that the very first thing a cannabis dispensary has to do is to conduct a HIPAA risk assessment, a full enterprise-wide risk assessment aligned to the standards of the HIPAA security rule. That's the first step to comply with the HIPAA standards and to comply with the state of Illinois regulations. And then, of course, following the risk assessment, these dispensaries are going to be required to follow the recommendations of the risk assessment, to implement reasonable and appropriate security controls to protect the sensitive healthcare data that citizens of the state of Illinois will be sharing with them. Really interesting approach, and I think we're going to see more and more states following this model in the coming few years. One thing that I think is really important about this approach, I think, if anything, it makes the HIPAA stakes even higher for these cannabis dispensaries. The stakes are even higher for them than they are for other healthcare organizations under HIPAA. And for at least three reasons. First of all, the enforcement for a cannabis dispensary is going to be much closer to home. It's not the Department of Health and Human Services out in Washington, D.C. who's looking over your shoulder. It's your own state health department right there in your own state capital, probably with an office right in the city where you do business. So enforcement is much closer to home, much easier for them to keep an eye on you and make sure that you're following the rules. Second, I don't have to tell anybody in this industry. The regulators are very nervous about you, and they're trying to they want everybody to be following all of the rules. They're very skittish about any kind of compliance violation, and I think we're going to see that they're going to be very skittish about any kind of violation of these HIPAA standards. So I think they're going to be looking at it very, very closely. Perhaps more closely than the remote Office of Civil Rights might be looking at a dentist's office or a chiropractor's office or something like that. And then third, I think that the enforcement could be extreme. In the case of a violation, I think the primary enforcement tool that these state departments may be using could just be revocation of your business license, could just be revocation of your license to operate a cannabis dispensary. So they may dispense with the whole civil fines and penalties and remediation programs and just shut you down. I think it's very likely that we're going to see the enforcement action against cannabis dispensaries to be very accelerated, very quick, and quite extreme. So I do think that the HIPAA stakes are going to be very high in this industry and very well worth paying attention to. And if you're in this industry, I think you should actually look at this as an opportunity for you to form a competitive advantage, because the companies who are going to be successful in this new industry that's maturing and evolving as we watch, the companies that are going to be successful are going to be the ones who are prepared and ready and willing to take on these compliance obligations, to face their compliance obligations in a proactive manner, get out in front of them and do the right thing under these, and particularly under the HIPAA security standards for their business operations. I'm Michael at Matterform. We specialize in conducting risk assessments for HIPAA covered entities as well as cannabis operations in the state of Illinois. So if we can help you with any of that, advise you, please get in touch and tune in here every Tuesday for more HIPAA for Humans.